Well, hello again, everybody. Welcome back into the Keep Boone Healthy Community Information Channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. We got the band back together again, unfortunately not for good news, but really updating you more so on a topic that we haven't talked a lot about in terms of Watauga County operations lately, but we're going to get into that conversation a little bit more, and that's vaccine deployment of a new round of shots. You know, we used this Keep Boone Healthy channel to get a lot of information out back in the early days of COVID about first doses and second doses. Now we have a third dose that has arrived. So we got our vaccine providers back together again to lay out some of that groundwork. Who's eligible, where they get it, when others will become eligible. We hope to answer some of those questions and plenty more here over the next few minutes. So want to introduce our group once again. We've got Jennifer Greene, CEO of AppHealthCare here in the community, Director of Public Health in Watauga County, Sean Burroughs, the Director of Pharmacy for Appalachian Regional Healthcare System, Alice Salthouse is the CEO of High Country Community Health, and Spencer Hodges joining us from Boone Drug Incorporated, where he is the Corporate Pharmacy Manager. So again, it's been a while since we've seen you all. I hoped to never see you again, but here we are. And you understand where I'm going with that. So Jen, let's start with you first, kind of a general update about where we are community-wise with COVID, with cases, masks, and now getting into this conversation about a new round of vaccine that will be available.
Well, I know folks are tired of hearing from us for this reason. So let me just acknowledge that and just say, it's important that we let you know what's going on. And I'm sad to say that we have seen our community impacted by the Delta variant. We believe, just like all the other places across our country and in our state, our cases are going up. We have over 70 active cases, I believe 73 today. That is what we saw back in more of the winter, early spring months. And so it's not just the fact that we're seeing more COVID cases, it's the fact that we are seeing them rise rapidly. That's very concerning. And so we want people to know that. We've asked people to wear a mask when you're indoors in a public setting, whether you're vaccinated or not. We hope you're vaccinated. There's lots of good reasons why we think that's important, but regardless, we want you to wear a mask. And the reason is because we know that because of this Delta variant, it's so contagious that you can spread it to others. And though we know vaccinated people are less impacted by far, they can still unintentionally spread the virus to others, which is why we're asking everyone to wear a mask when they're indoors in a public space. And now we have information about a third dose. So David, I welcome the other team members here to talk more about that, but I'll just say it's not yet for everyone. It is for a specific group of people who have an immunocompromised condition, or they are on certain medications or have certain health conditions. It's not just for anyone with a chronic health condition. That's the intent behind this new guidance. And it's specifically for people who've had one of the mRNA vaccines, Pfizer or Moderna. We don't yet have guidance for people who have had a Johnson & Johnson vaccine about another dose yet. But we know that there's a lot of work being done to evaluate that.
Well, Jen, thanks for starting us off. And to go back on the mask comment for a moment, remember that the town of Boone, the village of Blowing Rock, Appalachian State University all have some sort of language around masks in public spaces in place. So make sure that you check with those municipalities or individual businesses. Certainly the university has got their plans in place for how people are being asked to wear masks and when coming in contact with these places. So keep up to date on that. We have seen numerous municipalities and counties around the state of North Carolina begin to adopt that as well. So while we don't see that from a state perspective in terms of mask wearing from a mandate perspective, we are seeing more communities around us begin to adopt similar language to what we have. So as we get back into the vaccine conversation, we'll bring Sean in here for a moment. And Sean, I wonder if you can tell us a little bit about hospital operations as well. You've always been great to share that information, and then maybe kind of dovetail that into what this vaccine shot, this third shot, will be able to do to help folks that are, again, immunocompromised and may be a little bit more susceptible to getting introduced to COVID-19 at this point?
Sure, and thanks for having me on again, David. Last year when COVID came, it was really a slow roll here in the high country. It was really hair on fire in April for everybody, but it really didn't affect us till later in the summer into the fall, and then certainly build up through the winter months. From the health system's perspective, we were able to get ready for that. We had plenty of time to get ready for that and to plan for that. We knew that something was going to come this fall, probably, with the resurgence somewhat, but we just didn't have any idea it was going to be this much, this fast. We have 25% of our inpatients in the hospital right now are COVID positive, and we've seen very severe sickness, very severe illness. So it's been frightening, to say the least, to see how fast this has come on. We've seen more of a broadening of the age range of folks that we've seen admitted. It isn't necessarily just the 65 and older. We've seen, some of the younger population, younger adults as well that have been in here also. So from that perspective, it's been a different wave than it was last year with this new variant. From the vaccine perspective, as Jen mentioned, right now it's the immunocompromised and the immunosuppressed that are intended to receive the third dose. And they're calling it a third dose because they haven't built up, that patient population doesn't need a booster. It needs a third dose because they haven't built up the immunology from dose 1 or dose 2. They need a third dose to kind of get to where everybody else was after 2 doses. And so for this next month, that's really who's intended to receive this third dose. And it sounds like mid to end of September, when the FDA officially approves Moderna and Pfizer, that the rest of the population will be phased in similar to the way they were last year, with the healthcare workers and the elderly and the nursing home folks going first and so on. It would probably move a lot quicker, would be my guess, since it's just 1 dose. We don't have to do 2 doses. It's just 1 booster dose. So that should be coming middle to end of September. And the Johnson & Johnson data, as far as a second dose with that, should be coming towards the end of this month. So the folks that receive that, I don't think will be left out in the cold as far as getting a booster of something, whether it's another Johnson & Johnson or whether they okay a Pfizer or Moderna. That there will be an option for them. I'm fairly sure of that also.
Sean, you bring up an interesting point, and we've seen so much different news in the headlines about vaccines from, again, the last time that we talked several months ago. And one of those things centers around full authorization of vaccines. Can you give us a little bit of a kind of layman's terms view on what the difference is between emergency authorization and the full authorization from the FDA, or full approval from the FDA on these vaccines? And is there anything medically that anybody should be concerned about through that process, or is this just more procedural on the part of the FDA to go through and fully authorize the use and the abilities of these vaccines?
Yeah, truly at this point, with as long as the vaccines have been out, it's almost more procedural. You used a great word, a rubber stamp, or however you want to phrase it. There's been so much data out with these vaccines already. In my opinion, I don't think that there's anything to be concerned about, since it's not FDA approved yet. I think that's just, as you said, procedural, and it should happen, I would say, by mid to late September, if not sooner. Again, the amount of folks that have received this vaccine compared to what, a new medication, a new oral medication, or a new chemotherapy medication, folks that have received that get FDA approval, there's been so many people that have received the vaccine, and it really has, for a medication, done really well from a side effect profile. So in my opinion, there's really not anything to be concerned that it has not yet been FDA approved, because that's coming.
Spencer, I know that we talked a lot back at the onset about how new partners were being brought into a conversation about vaccine deployment that was really just set up at the beginning for public health agencies. Hospitals were certainly the driving force behind some of that early work. But then as organizations like Boone Drug, like High Country Community Health, other pharmacy providers, other providers in general were able to get access, it improved the ability for people to get access to shots that wanted them. How have you seen that evolve, and how is Boone Drug prepared to play their part in this deployment of a third dose and eventually boosters for those that are looking for those from Pfizer and Moderna?
Sure. So over the past few months, it sort of stabilized from what we could tell, just a more healthier rhythm of appointments and patients coming in. And so over the past few weeks, we've certainly seen those late adopters come into play here, of folks who may be seeing more people get sick or see the increase in cases. So it's encouraging them to get the vaccine. And then certainly when announcements of third doses come into play from the CDC, we immediately start getting calls. So what we have done is we have done our best to pivot because of the unavailability of Johnson & Johnson and focus efforts in on Pfizer and now Moderna, and having those options available at pretty much any Boone Drug location that you want to go to, either both or one or the other. And then certainly would add Johnson & Johnson back into that mix as availability comes. And so really we want to make it as convenient as possible for people. I almost have like nightmares of mass clinics a little bit from what we were doing of having to have so much staff to do that. And I feel like with the availability and the familiarity of the vaccine with so many providers now, it's going to be a lot smoother on the booster and third dose rollout than it was on the first and second doses, just not because of anything we did or anything anybody did, but just because of supply. So I feel like that's going to be a beneficial thing for the community. And so really we'll provide anything we can. We do appointments and we have all that on our website. And so we just want to make it as easy as possible for people to sign up, get a vaccine, and do what they need to do to protect themselves and their families.
You know, a lot of the folks that are dealing with a potential third dose or a booster here soon got these initial doses back in January, February. So it's been a little while. A few things have happened since then. One of the things on the vaccine front that has happened is that we have seen expiration times change. We have seen the way that shots are deployed even changes from that early guidance of having to get rid of every single dose. And it was an importance of, chasing people down to try to get vaccine in arms so you didn't have to throw that away. And now as supply obviously grows, some of that language has changed. Spencer, I wonder if you can talk some about just the operational differences now versus what we saw back in January, February as this was deployed. And Sean, if there's anything you want to add on that too, about just what people can expect as they get that opportunity to get a third dose or a booster here soon.
Yeah, I think for me, it's become less of a stressful thing about trying to make sure we account for every single dose, not because we have a desire to waste doses, but because of the flexibility of the supply chain and not having to feel like guilty about wasting a few doses at the end of the day. And then just basically the ordering capacities have also been improved. So Pfizer used to be this huge, 1,100 dose box that you got, and now they've shortened that or decreased that down to just 450 doses at a time. So we're able to move through that quickly, and that's much more efficient for us to be able to intake it, disperse out to community providers, and get rid of what we have. And we've not really run into any issue as far as just things going expired without being used. So it's certainly freed up the whole system and been much smoother here in the past couple months.
Anything to add to that, Sean?
No, I would completely agree. It's just there's the number of available providers of vaccine right now has definitely helped uncork the bottleneck that we had initially with it. So Right now, if you want to get it, you can go to a number of different places and get it, which is definitely helpful, rather than, as you said, having to tackle somebody on the Greenway to see if they wanted a vaccine. So
that never seemed to work as well as we all thought that it might. Alice, I know that we talked about a few things here a few moments ago. One of those I think that you laid out really well, the importance of paying attention at this point in time, with different groups being eligible for a third dose, or again, a booster once we see full approval later in the month of September. But we're in another one of those periods where it seems like information changes very rapidly. How are you advising your clients and patients to maintain as much of an awareness of what is going on the vaccine front as maybe we once had back in January, February, where it was top of mind as things were rolling out?
It is so important to stay advised about what's going on out there, and things are changing from day to day to day. And I think it's really important to have your ear to the ground. And I think Boone Chamber does a really good job of getting the public informed. So I would say stay close and listen.
Well, thank you for that. We appreciate the plug as always. You also brought up testing as something that I know as we get through different things, whether it's mask mandates, whether it's vaccine redeployment, if you will. But testing has been that one common thread that has been in existence since this all started. Maybe first for Alice, and then the rest of you can comment a little bit about how, with an increase in cases, how has testing availability kind of reinvented itself here in Watauga County?
Well, we have it available here at High Country Community Health. Just call the number and we can get you set up. You can drive up in the back and they come out to the car and test you in the car, and you'll have your results in 15-20 minutes. It's another way of staying informed. If you're fearful that maybe you have been exposed, or that you're feeling sick and you don't know if it's allergies or a cold or what, then you should take steps to be tested to see, so you can protect yourself and the people you care about. Our number is 262-3886. If they call that number and say, can I get tested, we'll get them right in same day.
Spencer, I know you all at Boone Drug have expanded your testing capabilities. You've been there since the very start of all of this. I remember your first reports out in the parking lot in the cold doing testing. How has Boone Drug changed and applied their abilities to test a little bit differently here throughout the summer? Oh, you're muted there, Spencer.
So we moved our testing back to its original location at King Street, just because of the drive-through capabilities. So we have rapid testing available there for patients if they need like official documentation from Boone Drug. But fortunately, we've seen the technology that we've used the whole time become available just to the consumer without the need for a pharmacy or someone to administer it. So we have the at-home rapid test available in all of our stores, and that has been just amazing access for the community to be able to walk in, get one, and go home and not have to spend a lot of time waiting in lines. And I could just think back about the hours and hours of car lines towards the Christmas of last year. It just seems hard to believe from where we've come. So access has just totally boomed. And so again, we're just trying to make it as convenient and easy as possible on people to get what they need.
Sean, is the best way to interface with the hospital system in this case still to be going through individual providers?
Yeah, you can. Well, we have a lot of information available on the website still, and we're starting to repost some of the things that we had on there before. But yeah, anybody that's affiliated with an ARMA provider, just contacting them, and they can facilitate the testing information. And I would say this real quick, David.
Yeah.
If you are symptomatic, regardless of what test you get, if you are symptomatic of what could be coronavirus, but could be a regular virus, and you get a negative test, but you still have a low-grade fever and you still don't feel well, I implore you to use common sense and stay home until you are, clear of the symptomology, because there is a potential for false negative tests. There always has been. So just using common sense is key to making sure that we're not spreading this any more than we already are.
Good
Jen, I
point.
know you've been talking about that from the very beginning as well, the importance of staying home if you're symptomatic, staying away from large crowds. Combine that with the health department's expanded testing operations. Can you share a little bit about what you're doing there to help serve that need a little bit more from your standpoint?
Well, we expanded our testing in the beginning and we backed off a little bit, but we're back up to 5 days a week. We're doing 8:30 to 10 drive-through testing, no appointment needed. We do have rapid tests available. We also have the PCR send-off test, which is also helpful if you have symptoms to make sure that we've got 2 ways of ensuring that you are definitely not positive. So I think it's great to have all these resources with all of the providers who are offering, options for people to get tested. And I really want to just emphasize what Sean said. If you're feeling poorly, don't push through it. We went the whole last year trying to retrain our brain. I've been one of those to drag yourself to work sick. This is not the time to do that. And do notice, I've heard people say things like, well, I thought it was just allergies. Well, if you're normally going to have allergies, okay. But if you have new symptoms arise, if something's just off, there's so many testing options available. It's better to get tested, even if you've been vaccinated.
Well, Jen, I wonder if you can start us off on one last quick trip around the horn as we talk about eligibility for this 3rd dose. And that's really what got us back into this conversation again. Can you all explain who is eligible at your individual establishments and what the best way to interface with for anybody that is eligible and would like to get a shot? When does that work? How does that work? And how can they get in contact? And again, Jen, we can start with you.
We're doing vaccine walk-in appointments every afternoon from 1 to 4. You can also call us and we are happy to answer questions or schedule a special time for you if you want to come at a different time of day. We are encouraging people to really understand who this is intended for, but we're not asking you to give anything else beyond, we're going to be asking you a few questions about your medical history. But it's going to be based on what you share with us. So again, we're looking for people who have severe or moderate immunocompromised health history. That's who is eligible for this vaccine. And also for people who have had Moderna or Pfizer in the past. We certainly are not yet authorized to give something to folks who have had J&J vaccine. So briefly, I would just say, be prepared that we might ask you a few questions just to collect that information, but that's what we're here for. If you have a question, you can call us in advance. Otherwise, know that we have that walk-in availability.
Yeah, and real quick before I go around to the others, in terms of documentation, should you be expected to bring your vaccine card so you can look at dates? Is that helpful, or is that information that can be searched at this point in time by your provider?
I think it's always helpful to have your vaccine card handy, and I think all of us would probably appreciate you bringing it with you. But if you don't have it, don't worry. We can talk you through it, and we can certainly work through looking things up if we need to.
Excellent. Sean, can you explain to us how the hospital system is handling the same kind of procedures?
Yeah, we have clinics at the Baker Center out in Linville, and we have clinics at App Family here in Boone. Those are 3 days a week and available if you call. You can determine when those, when an appointment, you don't even need appointments, it's just walk-ins at this point in time. Unless we get too busy, we'd like to continue with that availability and that flexibility. So we have those 2 locations that you can get it. And I would say also that now's a great time to get vaccinated, whether you haven't been vaccinated previously or your time comes, or immunosuppressed or immunocompromised now, or when the booster comes. We've never had good treatment options for patients in the hospital with COVID. Just never been able to find an antiviral that really works. And the medications that we have been using that may be helpful are on shortage and back order and really tough to get. So if if you've ever been on the fence about getting it, now's a fantastic time to get it. So I urge everybody, maybe someone's calling you, Alice, to get vaccinated right now. That would be
I bet
perfect.
that's
Maybe
it.
we already got to them.
Oh my, I'm so sorry.
But
I
yeah,
turned my
so-
phone off.
Yeah, you can get it at App Family Medicine. You can get it at the Baker Center. But yeah, I really would love for folks to ask questions about it if you have questions about whether or not to get it. But I don't want to see you in the hospital. You know, once you get in here, we're going to do our best supportive care for you, but there's really not a treatment. There's not a cure. And so the best way not to get in here is to get vaccinated.
Spencer, can you detail for us how Boone Drug is handling this third dose right now and how people can interface with you and your team?
Sure. Yeah, it's pretty cut and dry. We offer clinics all the time, every day, pretty much. Walk in, you can get an appointment, or you can just use the appointments as a means to find when we're giving it, and then just come in and get one. Third dose, just attesting that you've got one of those severe or moderately severe immunocompromised health histories. Really as simple as that. And you can just use our website. Everything's on there. Wherever you want to go, we're in 4 counties right now. So Avery, Ashe, Caldwell, and Watauga. Actually, Burke County too. I can't leave East Burke out. So we're all over the place.
Thank you, Spencer. And Alice, before you get called about your car's extended warranty again, can you tell us how folks can interface with you and get the shots?
Like I said before, just call, whether you need testing or vaccination, just call the number and we'll get you set up. I do want to say one last thing. There are so many emotions tied to all of this. Some people want the vaccine and they are so grateful. Others get angry whenever you talk about it. And I would just encourage everyone, let's be as kind to one another during this difficult time as we possibly can. We have seen a big boost in people that are having like substance use disorder issues. And if you need help with that, you can call our number as well. We can get you in and start helping with some of the behavioral health issues with the anxiety and all of that. So I think one of the best things that we can all do, wear our masks, get vaccinated, and be kind.
Very well said, Alice. I appreciate you bringing that up. And one final question for you, Jen, before we shut this down for now. One of the differences that we saw, especially when we went first dose, second dose back in January, February, when this was all really starting, was availability within the community. And all of you have detailed on how dosages have changed, the way they're sent is changed. Is there anything else about availability of vaccine in this community that you'd like to share with people that may just be slightly different from back in the winter and spring when folks really were knowledgeable and deeply involved in this community conversation?
I think most of it's been covered. I would just add, we have a lot of ability to keep each other informed, and where there might be a need in one place or another for a different type of vaccine, we have the ability now. It's a lot more readily available for us to share. We want to send everyone to Spencer and just let him give everybody a shot, but he's graciously been willing to share with their supplies, so we've been grateful for that. But I think we're a community, and we're still trying to help each other. So if we have a need, I would say the biggest thing is that I really think all of us have said this, but just please don't wait any longer. We hope that you will ask one of these professionals, call your healthcare provider, talk about what concerns you have. It's okay to have questions, but we really don't want you to be one of the names that we see that's hospitalized. And we are seeing more of that, not just here, but across our state. And I am very concerned for people who aren't vaccinated. So please, please, please don't wait any longer. If there's anything you take away from this, if you've been vaccinated, I will just say you might be the right messenger to ask your loved ones, the people you work with, people you interact with, to help point them to credible information. Because you know, we've been saying this for a while. We might need your help at this point to be the messenger to carry that and encourage your loved ones to be vaccinated.
Well, and I know we've interfaced with a lot of employers that have been talking with staff members, and we continue to point in the direction of these professionals you see here. If you need more information, let us know. We'll be happy to connect you with any of these folks and countless others here in our community that are providing good, credible information that you can give to folks to allow them to make informed decisions about their health and the health of others. So, and again, speaking on behalf of our entire community, I know that large talk about vaccines has been off the radar for some who were vaccinated back in the winter and spring. I just appreciate the fact that you all have continued this conversation and continue to evolve your own processes to work with one another. I know that back in the days when only a couple of you had vaccines and you were working in kind of a way to introduce other partners, it was very different. Now being able to share information and share resources together, that just makes us all better off. So thanks for continuing to carry this torch of such important work. And we look forward to catching up with you all again, charting some progress and hopefully seeing our community's health situation improve. So thank you again for all of your time, and be safe out here on this stormy afternoon here in the high country.
Thank you.
Thanks, David.
Thanks, David.